In the beginning of the COVID-19 pandemic in Nigeria, this National Reference Laboratory used to service all 19 states in Nigeria as well as the Federal Capital Territory. All samples from all of those states were brought here. But now, with 69 laboratories scattered all across the country, the National Reference Laboratory, still gets some sample from some states who have spills because the capacity of this lab is still the biggest. Nigeria's strategy for the management of COVID-19 has always been test, treat and isolate, with testing being identified as the first step in the containment of the virus. The national strategy has seen some modifications.
National strategy was focused on making sure that every state has a PCR to be able to test. And that we've been able to achieve up to some level. At the moment, we have only one state that doesn't have the capacity to test. But then, as we went ahead, there's also the second idea of making sure that we use a low-throughput GeneXpert. GeneXpert was already in country used for TB, using the high-throughput equipment that we've already seen, the Cobas, and then the other one that is not existent here, the Abbott machine. These are two machines that can do a large number of tests in a day, and they were earlier brought in country for the PEPFAR program for HIV. But there are now tests that can be used for COVID on the same machines. And we are able to use these machines to also increase our capacity to test for COVID. So those who are coming into the country will also need testing. What we have done is to prioritize this level of testing to go to the private laboratory establishments where people will now have to, pay and get these services so that they can free up our public health laboratories to continue on the free testing that we have done for the purpose of surveillance.
Nigeria has the capacity nationwide to test up to 15,000 samples per day, with this facility alone having a 3,000 test capacity. Nevertheless, only an average of between 600 and 1,500 samples are tested daily. Nigeria has seen a drastic decline in the number of samples collected in 32 states in the last month. Experts say the fear in the early stage of the pandemic is gone, and a new strategy is required to improve testing.
Initially, when COVID came up, there was this fear. People were afraid and all that. But it looks like the success we've had in terms of morbidity and mortality, which I also attribute a lot to the response of the federal government. A lot of our people do not feel scared as they would have, and then would have been able to present themselves voluntarily for testing. We are also working hard with the states to actually go out and find the clients. Like I said at the beginning, every person who had a little fever, based on the fear, would go out and seek a test. But now people are rather, they've gone back to the old way of trying to manage their ailments the same way they used to do it before. So we now need a much more active method of case finding. So that's why we are discussing with the states at our level to increase activities, increase surveillance activities to pull in people originally who would have come on their own, but now who feel that they don't have any symptoms and they don't have any reason to test. And again, it's because there is need to let people understand that you don't need to have simple symptoms to test for COVID.
There is at least one testing center in 35 states and the FCT. However, the Nigerian Center for Disease Control has continued to lead the public health response, working closely with all states to support their response to the pandemic.
Primarily, our responsibility is to support. We want states to own these activities, and then NCDC supports them. We continue to provide technical assistance. There's no doubt molecular testing, COVID, and the information around it are completely novel to us. So NCDC makes sure that they work with the states to cascade information that we get globally in terms of global technical best practices, even in testing, by training the people who do the testing in each of these labs that we open. So if you look at it, you'll find out that every information about COVID that is being reported real time from the states, from the field, are all updated here. Now, SOMAS is available in not all the states of the Federation, so that's why we still use manual data capturing in some states. But NCDC had this strategy to adopt these SOMAS even before COVID came. And we are slowly rolling out from state to state before we are caught up by COVID and the lockdown. So we couldn't get all our states ready to use this.
The frontline health workers are not left out in the infection of COVID-19. With no end in sight for the pandemic, fatigue has set in.
Yes, we've had a number of cases. I think like 8 of us got exposed to the infection, yes, so we had to stop work and isolate at home while being on treatment. And after 2 to 3 weeks, we resumed. Basically, we just try to do our work and work within the time range, and then after we go home to rest.
The United Nations warns that the decline in the number of confirmed COVID-19 cases in Nigeria is a collapse in testing and not a sign that the virus is being contained. It says for Nigeria to contain the pandemic, increased testing must be a priority. Amaka Udeh, Arise News.